Okay, so Eden, I'm so excited to dive into the history of Medicare today. It feels like such a monumental thing, but where did it even begin? Like, who first thought, hey, let's create this massive healthcare system for seniors?
That's a fantastic question, Avery. To understand its genesis, we need to go back to a time when many elderly Americans faced significant challenges with healthcare. Before Medicare, over half of seniors had no health insurance, often leading to poverty or inadequate medical care. The idea truly gained traction during the Great Depression, but it was a long road to implementation, driven by the belief that healthcare shouldn't be a privilege, but a right, especially for our older population.
Seriously? Over half? Wow, that's incredibly stark. So, it was born out of a real crisis then. And it wasn't just a sudden idea, it simmered for decades. Who eventually championed it and got it across the finish line? I'm picturing some epic legislative battle.
Indeed, it was a battle. The major breakthrough came with President Lyndon B. Johnson, who signed Medicare into law on July 30th, 1965, as an amendment to the Social Security Act. He actually presented the first two Medicare cards to former President Harry Truman and his wife Bess, recognizing Truman's earlier efforts to establish national health insurance.
Truman getting the first card? That's incredible. So LBJ really sealed the deal. What did it look like then, right at the start? Was it already like the Part A, Part B system we talk about today, or did it evolve from something much simpler?
It was surprisingly similar in its core structure from the outset. Medicare began with two main parts: Part A, covering hospital insurance for inpatient care, and Part B, covering medical insurance for doctor services and outpatient care. The idea was to provide essential coverage, addressing the most pressing healthcare needs for seniors.
That's brilliant foresight. But it's so much more complex now with all the different parts and plans. How did it evolve from that initial fundamental structure into the multifaceted system we navigate today? I imagine there were a lot of twists and turns along the way.
Absolutely, Avery. Medicare has undergone continuous evolution to adapt to changing healthcare needs and medical advancements. We saw the introduction of Part C, or Medicare Advantage, in the 1990s, allowing private companies to offer plans with additional benefits, and then Part D for prescription drug coverage in 2006. Each step has aimed to refine and expand the program, shaping it into the comprehensive, albeit complex system we have today.